Hi everyone, my name's Sid and I'm a current graduate trainee working at Notts County Council, and I started in January 2021. A bit about my background: I studied politics and international relations at the University of Nottingham, and I followed that with a master's in international security. The scheme actually came on my radar about summer 2020, and the reason I applied for it was mostly because of just the variety of work you do on the scheme. So essentially, it's a 2 year scheme that involves 4 placements. And I was really excited by the fact that these placements were so different and diverse. So at the moment, I'm working in the development corporation team. So for me, that's been kind of outside of my comfort zone a bit because my background is not really in economics. But I've just learned so much, even though I've just been here for 2 months. And I found it challenging, but also like really rewarding at the same time. The things that's been amazing is just how much investment there is in not just your personal development, but also your professional development. So I've been lucky enough to actually meet so many people from across the council already and at different levels. So I've had access to senior managers and a chief executive. And for me, that's been really good to hear about their perspectives and um, their experience with the council and how they made their way up. So you really do get that exposure, which I don't think you get on many other grad schemes in terms of applying for the role. So for me, it was also all virtual, as it will be for you, especially with the virtual assessment centers and the virtual interviews. And for a while, I was a bit anxious because I didn't really know what to expect. But having done all of that now and looking back in hindsight, I can say that I was really happy with the process. um, I was never left in the dark. So if I ever had any questions or queries, the recruitment team were really approachable. I just felt like they did support me quite a bit and help me through those different stages. And actually, in terms of maybe some things to help with the application process, especially because it's virtual, I would say really just take in the process, learn from it because it's very different. And you're going to meet a lot of interesting people along the process as well. Research what you find interesting about the council. I was really interested in from the services aspect, like how the council was dealing with COVID-19 and this extreme pressure they have to deliver these essential services. So that's what I found interesting, and that's what I kind of used in the application process. Yeah, just have fun. I think there's loads of sources online as well. The website's great for information. There's a YouTube page, so kind of just use all of that to help kind of help frame your application.
I like my job, and I've been a mental health nurse for almost, it's more than 40 years, so I'm not going to give my age away. September last year, I was walking my dog and she happened to pick a fight with another dog. During that fight, I intervened and I was bitten by either of the dogs, I don't know which. As a consequence of that, I contracted sepsis with quite a virulent bacteria. Essentially, went into shock, lots of organ failure, and the result of all that is what they call a quad amputation. All of my life I've been very independent. I never felt as if I'd lose it. I always just thought, and I still do, it's something you're constantly working towards. My wife's the gardener, not me. Used to do the heavy jobs. Yeah, the carer thing is quite important. I think the big thing for Anne has always been, if I know the help's there and how to access it, then that makes me feel better already. When I was considered to be medically fit, before I was actually discharged, this rather nice man called Nadeem turned up, and he explained that he was the hospital social worker. He explained the concept of social care, As soon as we started the assessment, it was obvious that we were also going in a direction.
What makes me proud about working within the hospital setting is having the opportunity to work with hospital OTs, physiotherapists, doctors, working with the individual to meet that individual's need collectively. Crucially, the individual is the heart of the work that we do.
The right services were put in place in a very caring way. Nadeem was the hub. Essentially, it did feel like a joined-up approach.
I think Julian naturally is a confident man, and I think it was about trying to ensure that we harness that positivity that Julian has. The strategy offers us opportunity to work with individuals around their needs and promote their confidence and independence, and allows them structure and control to think about the services that they want and how they want to live independently within the community.
All the services that I need have been provided and I feel well cared for. The difference that adult social care has made is the difference between being in an institution and being miserable and being at home and being happy.
My life was a bit of a struggle. I've always wanted to do things, like be out and about, meeting new people. Basically, my head was all over the place.
I started working with Shane in May 2017. His social worker in the transitions team referred him to the Knots Enabling Service. I know that Knots Enabling Service have changed Shane's pathway for the better. His social worker told me that he was planning to commission 2 days of day services for Shane. And now what we have is someone who's happy with their life, working hard, getting paid, and for those other 5 days a week not being bored, sat at home.
Ever since me and Aidan have been talking, ever since I've called him my brother, he's shown me some good skills, he's a nice lad. I can't have no one better than him, because he's quality.
I quickly found out that Shane was very good with people and his social skills were great. He always makes me laugh. He wanted to do some gardening and also he wanted to help people, which is why he did some volunteering at the community gardens. I increased a person's confidence by focusing on what strengths they do have, because I believe if you focus on things that interest someone, you're likely to get the best out of them.
I have the confidence to actually do something now in my life.
I'm proud that I've enabled someone to be able to do those things that they wouldn't necessarily be able to do before or believe that they could do. And I think that sums up what the Knots Enabling Service is about. We've changed someone's life for the better and actually made him more independent.
My passion is basically birds of prey. The best of all are my peregrines. Everything you've got is all based on a bond. If you haven't got that bond, you haven't got anything worth having. When I got told that I'd got dementia, I was told that it would gradually get worse, so it meant I had to get rid of my car. I got rid of quite a few of my falcons, what have you. Hardly anybody ever rings me up about falcons at all, see. You can't expect it to go on forever, but anyway, it's finished with now. Mary and myself do everything that we can. We help one another. So we've said at times we'll have to have some help.
As an occupational therapist, I try to promote a person's independence. I always start off with a person-centred approach because we just want the best for the person. So I think that's quite a good thing as a therapist to work in a team that do actually promote that. When George initially came home from hospital, he did state that outdoor mobility was one of his goals.
I'd been in the house for a long time and I was quite pleased to be able to get out and have a walk. I says, I haven't been out for weeks.
From the very young age, when I was a child, I used to idealize my father. He was very fit and athletic.
Good morning, everyone. I'd like to welcome you all to this meeting of the Adult Social Care and Public Health Committee, which is being held remotely, broadcast live and recorded for publication, with the majority of the 11 members joining the meeting from their own homes. I'm Councillor Tony Harper and I'm currently the chairman of this committee. For the benefit of the viewers of the live stream, I now ask the clerk of the committee, Joe Toomey, to list other members and officers present today. Joe, please.
Can't hear you, Joe.
You're muted, Joe.
I don't know if you're muted, but I just can't hear you.
Just bear with us a second, please.
Let me try adjusting my microphone.
That's better.
Yeah,
Perfect. Thank you. As well as the chairman, we also have councillors Joyce Bosniak, Richard Butler, who's here as a substitute for Councillor Dr. John Doddy, Boyd Elliott, Sybil Fielding, David Martin, Francis Purdue-Horan, Andy Sissons, Steve Vickers, Muriel Weiss and Yvonne Woodhead. And as well as myself, we also have the following officers present today. Corporate Director, Adult Social Care and Health, Melanie Brooks, Consultant in Public Health, Kath Pritchard, Service Director, Living Well Community Services, Ainsley McDonnell, Director of Transformation, Grace Natoli, Group Manager, Integrated Strategic Commissioning, Claire Gilbert, Principal Social Worker, Mary Reid, Team Manager, Residential and Nursing Care Services, Gemma Shelton, Senior Public Health and Commissioning Managers, Lucy Jones and Rebecca Atchinson, Senior Executive Officer, Jenny Kennington, and also joining us today, we have Kashif Ahmed, who will be joining the County Council as the Service Director for Strategic Commissioning and Integration.
Thank you, Joe. We'll now move to item 1 on the agenda, minutes of the last meeting, 8th of February 2021, and they're on page 1 to 4 of your agenda pack. Can the minutes be agreed, please? I'll just take a quick show of hands. Yeah, thank you very much. They are now agreed. Item 2, apologies for absence. I know Joe's already mentioned Councillor Butler is replacing Councillor Dr. John Doddy. Anyone else, please, Joe?
No, all of the committee members are present and correct.
Thank you. Item 3, declarations of interest. So do any members or officers present have any disclosable pecuniary interest to declare? And do any members or officers present have any private interests, so that's either pecuniary or non-pecuniary, to declare? As I always say at this point, if you find you're coming across an agenda item where you do have an interest, then just signal it up then. So thank you very much. I know we've got a long agenda today. We've got a lot of business like we always have at the end of an administration. But today it's the last day for 4 of the members here. So we've got myself, Steve Vickers, Joyce and Muriel. And I'd just like to say, Joyce and Muriel, you've been stalwarts on this committee. You've been serving on it for a lot of years. Your experience is invaluable, and I'd just like to thank you both for all the advice and help you've personally given me. I know we perhaps don't agree all the time politically, but we're not a million miles off, and your input has been really useful. And I'd like to say I'll miss your input, but I shan't, because I shan't be here myself. But thank you very much. You've always come up with common sense, really responsible input into this, and I thank you very much. And Steve Vickers, thank you very much, a colleague. We've worked together. You've been chairman of different committees. You will also be sadly missed. So would you like to say a few words, Muriel, first, please?
Thank you, Chen. Thank you for your kind words.
Yes, I want to thank officers and political colleagues for what we've shared on adult social care and public health over the last 8 years. When I began social work in the 70s, in the wake of CBOM, bringing welfare, children's services and mental health services together to compete for funding with the health service, work with older people and people with disabilities, it was called welfare then, was at the bottom of the pyramid. And public health was on and off the scene and seen as something to do with polio injections. Fortunately, that has largely changed. And we all now appreciate that such work with older people and folk with learning disabilities is creative and sophisticated and highly skilled and can be transformative in people's lives. These years have been exceedingly challenging. David Pearson, when he was here, said that his last 4 years, were the most challenging of his career because of the dreadful financial cuts. Fortunately, with the senior officers we've had and still have, we have not only survived, but set up and maintained projects that have been nationally recognised. I wish you all well and hope that the next committee will give you the support that you so richly deserve. Thank you, Chair.
Thank you, Muriel. Thanks for those words. Joyce?
Yeah, thank you, Tony. Like Muriel, I didn't start with social care in the 70s, but I have been around for 28 years as an elected member, and during that time I have worked on occasions and latterly with adult social care, and perhaps one of the best things that's been for me is to see those changes and get the chance to work with people I have a huge regard for and highly respect. I've seen off a few corporate directors in my time. I've also seen off quite a few chief execs as well. And that's quite interesting. It's quite interesting to see what people bring, what new people bring. And sometimes you get people with bright ideas and they come into the county council. And then usually after about 6 months, those bright ideas have been beaten out of them. So they fit nicely into the system, which is a shame because I do think that we need lots and lots of fresh people with fresh ideas. And it looks as though we've got one as well, of course, with Bashif, who's newly joined us, because one of the challenges I think we have ahead is that, of course, we have to nail integration with health. And although you heard my comments last week about what I thought about the government's white paper, seems to say all the right things, but I think it's lacking some teeth. And we need to be sure that adult social care across the board is fighting our corner and we're not seen as an appendage to the health service. And I think that could happen if we keep our eye off the ball. So I just want to say that whoever is here in May will have a challenge on their hands and they need to address that and work alongside Kashif. But the other thing I'd like to say is I'd like to thank every single one of the officers throughout those 28 years that I've worked with, particularly in social care, because their dedication and their commitment is absolutely fantastic. And I also know that we have some very, very good elected members who have been committed to this agenda and will do so long after we four have gone. But I just want to thank everybody on this committee who I know we've argued with at times, but that's all part of what we're here for. We scrutinise and question some of the decisions that officers and we make, but it's always done in a good-natured way. And whenever we've gone out of the chamber, because we are normally in the chamber, whenever we've left the chamber, that's fine. We're still good friends, and that is important to me. And that's what I will miss more than anything. So thank you.
Thank you, Joyce. Councillor Vickers.
Thank you, Chairman. I too would like to thank the officers and colleagues for which, without them, my first few months in adult social care was a world full of acronyms, and clearly it still is, as well as health, NHS, adult social care, all the rest. Anyway, just like to thank everybody, all the colleagues around the screen as we speak. Some of you are friends, some of you are good friends, and I will look forward to keeping my eyes on you all in Singapore.
Oh,
Thank you very much, Steve. I'll leave it at that because otherwise we'll open another conversation up. So from myself, really sad to be leaving, really. I know when they put together adult social care and public health, I thought, crikey, that's a massive portfolio, that is, until 12 months ago when when the pandemic hit us. Then I really knew how busy it is. But everybody's pulled together, everybody's worked well with it. So I'd like to thank all the members of the committee. When I took over as chairman, I said my aim was that everybody works together for the benefit of the people of Nottinghamshire, putting together political score, point scoring and such as that. And I can say happily that I'm really, really happy that that has happened. And everybody, to every single member on this committee, has worked really hard to pull together for the members of Nottinghamshire. And I know some committees are very political, but I haven't found that at all on this one. We've all pulled together. We've got political differences, as you would expect. But as Joyce said, everybody's pulled together. I would like to thank Jo Toomey and before her Sarah, Steve Ford, Democratic Services, for the fantastic support they've given to our committee. I'd like to thank Melanie. What a star that we had come and join us with all her hard work and effort and passion for adult social care and public health. She has been a real revelation to this committee and to our work, plus all of her directors, service directors and everybody in the whole organisation. And Jonathan Gribbin at Public Health and all of his consultants and all of his staff. Like I said at the full council meeting, every member of our staff, voluntary, paid, are heroes in my eyes. They've done a fantastic job. They've risen to the surface during the pandemic and I can't thank them enough. So thank you very much. I'd just like to give them a round of applause, if I may.
Yeah, well said.
Thank you. Councillor Martin, please.
Yes, thank you, Chair. First of all, I'd like to say thanks to Joyce and Muriel and Steve and yourself for your contributions to this committee. They've been fantastic. And I don't see this as a really heavily political agenda on this committee. We're all here to get the job done, and the diversity of our backgrounds helps ensure that the path is clear and the majority decision takes the way as it should do. And I think the officers have been absolutely fantastic, as you've said. We all said that last Thursday at the full council meeting. We couldn't have survived without them, especially during this last year. They've been absolutely fantastic, really stepped up to the mark. And I'd also like to pay a personal tribute to Tony for being an excellent chairman. Thank you, Tony.
Thank you very much. Thank you. Right, if there's no more speakers, sorry, Councillor Purdue-Horan.
Thank you, Mr. Chairman. As the longest serving Conservative member on this committee, which was a happy accident in 2016 for me. I just want to add, Mr. Chairman, that it has been a pleasure, a privilege to work with all four of you, and obviously particularly yourself, Tony, and you've given such sterling service to the people of Nottinghamshire, really, on this vital committee. And it's said that one of the greatest attributes of any politician is to be lucky. And you have been extremely lucky with dedicated councillors who, as David said, have not used the committee for any selfish or partisan politics, but also to have the assistance of Sir David Pearson and Melanie Brooks, and everyone in their teams has been such a privilege to work with you all. So best of luck for the future in whatever direction life now takes you.
Thank you. And by the way, it wasn't an accident. You deserve to be Vice Chairman. Councillor Boyd Elliott, please.
Thank you, Chair. Thank you, Tony. I'd just like to echo what's already been said. It's been I was a bit when I left Children's and Young People's Committee, I was a bit I didn't know what to expect at adults really, but I've had it's been such a learning curve. I think it's been a pleasure to work with Joyce and Muriel, because they're so knowledgeable around the subject, and working with Francis as a vice chair, and Tony, I think you've been an excellent chair, and you've kept the committee flowing. It's always been a pleasant place to be, and look forward to continuing the hard work that you've set these foundations for us going forward. But just like I say, we'll miss you, Tony, but won't miss your towel.
Yeah, for anybody not in the know, I go for a run every day, and I tend to put my towel out to dry in the office. So that's what Boyd's referring to. So I'll leave it in your drawer, Boyd, for future reference. Right, thank you very much. We'll now move on to the agenda proper on item 4, and can I welcome Kashif, the new service director. Welcome, Kashif. Lovely to have you with us, and I hope you have a memorable time with us. So you're more than welcome. Thank you. So item 4, developing the adult social care and health approach to prevention and early intervention, and you'll find it on pages 5 to 12 in your pack. The report sets out the national and local drivers for the development of a prevention and early intervention strategy for adult social care and public health. The report provides an overview of the current services and approaches that support this agenda, along with the learning that's emerged from the pandemic response in relation to particular cohorts. The report proposes that this strategy will be developed in alignment with the corporate prevention strategy. The report seeks approval to extend the lifetime of a number of contracts which support prevention until August 2022, in order that the services commissioned going forward are informed by and underpin the strategic direction. The recommendations for this report, as set out on page 10 of the agenda pack, are that members of the Adult Social Care and Public Health Committee, 1, approves the establishment of an Adult Social Care and Health Prevention and Early Intervention Board to develop a co-produced adult social care and health prevention and early intervention strategy to inform the future commissioning and configuration of adult social care and health services, as well as to align to and support the wider corporate prevention strategy. 2, agrees to receive a further report on the proposed prevention and early intervention strategy for consideration in September 2021. And finally, 3, agrees to postpone the recommissioning of preventative service identified in Appendix 1 and to extend current contracts through to the 31st of July 2022. I formally move the recommendations. Do I have a seconder, please?
Happy to second that, Chair.
That's Councillor Boyd Elliott. Thank you. Corporate Director, Adult Social Care and Public Health, Melanie Brooks, please.
Morning, committee. So before I present the report, I would like to also just say it's been a pleasure to serve you as committee and you as chair, Councillor Harper. So you've all done a very good job, I think, of keeping us on our toes and particularly supporting us through the pandemic. So I know the team appreciates that, and I will pass on your thanks to the wider organisation. So we do appreciate that. So coming back to the prevention report, so prevention makes intuitive sense, doesn't it? So if we can enable somebody to enjoy good health and well-being for longer, it makes good sense. And as well as it being one of our statutory duties, I think it's also a cultural approach. So Claire is going to, with the support of Gary, just talk you through what we're talking about with prevention, what we mean in terms of the approach, how it happens to everybody who's a resident, and whether they're enjoying really poor health and well-being or really good health and well-being, and the sorts of things that we'd expect to have in place in terms of the service pieces, the things that we might expect to see in a whole range of preventative approaches. So I'm going to pass over now to Claire and Gary, who are going to talk committee through some of the key themes we're talking about here.
Hello, committee. This is a really significant shift in terms of strategy for Nottinghamshire, and it moved towards a connected care function. And Claire's just put together a short briefing, a PowerPoint to take you through the main aspects.
Okay. So hello everybody. So yes, thank you, Jenny. So I'm just going to take you through just a few slides just to sort of share the approach as stated. So the paper sets out the approach that we propose to follow in developing a prevention strategy, the rationale for this, the impact from COVID on our thinking, and our proposed extension of a number of the contracts to support this work. Next slide, please. So Nottinghamshire already has many initiatives which support prevention and early intervention. And as a department, we've invested heavily in our maximising independence service. We also commission a number of preventative services. And as you know, in normal times, the focus of public health is on health promotion and that wider health kind of preventative agenda. However, what we don't have is a coordinated approach as to how we deliver this, or a clear set of principles which shapes what we're investing in. Next, please. So what we want to do is, the ambition of the strategy is to pull together all of the different strands, both internally, as with some of those as I've mentioned, and with external partners such as with our district councils, with housing, with the wider community assets. One of the initiatives in one of my little cells that I've got there is around local area coordination, which many of you will recall have already come to committee with. And this is a new approach to working with the heart of our communities, and it will help inform our approach going forward and understanding from the centre of our communities what the need is and how we respond and build to that need at the earliest possible opportunity. Next slide, please. So, and if you just click at yes, so obviously not only do we want to do this work and does it sit with our own sort of strategic set of priorities, but actually we need to do this. Particularly under the Care Act, we have a sort of duties to, in order that we assure that we have a larger market economy, that we support prevention, we support early intervention, and as referred to before, we sort of support integration with our health colleagues. So this is something that is key, that there is an ask for us to deliver against. Next slide, please. So the approach puts people of Nottinghamshire and their families and carers at the centre. So if you could click again, Jen. Through the use of strengths-based approaches, the 3 conversations, maximising independence and place-based care, we're hoping to enable people to be supported to support themselves wherever this is possible. And so in terms of those those circles sort of moving out, we've obviously got the person at the centre, their family and their carers, the assets that surround them in their community, and through those kind of interventions, we can hopefully support many people at that level of intervention. And through the 3 conversations where that's not sufficient, we can either look at a brief intervention or, where required, a longer term provision. And the way in which we can do this is, for many people, advice and signposting can support people to kind of access those sort of assets around them. And we can support, we're aiming to support people at the earliest possible time. Prevention can take place at every stage of intervention, from the whole population initiatives such as sort of healthy eating, right up to targeting to support to help someone to stay in their own home rather than going into longer care. So this strategy is very broad in its ambitions to look at that whole breadth of approach, from whole community right up to very targeted interventions. Next slide, please. I think one of the things that I highlighted in the paper, and I think it has been our learning from COVID, because obviously that has shone a light on particular individuals and particular needs that we have seen emerge during COVID, as well as learning about how we can do things differently and more innovatively. We're very conscious that, you know, for many of us, our mental health has suffered through the course of COVID. And we are going to be seeing increased needs at all levels, and we are going to have a different approach for how we tackle this and ensure that those needs are being properly met. Through COVID, the council worked amazingly well with clinically extremely vulnerable people, reaching out to them through the coronavirus community support hub and through sort of targeted approaches to reach our most isolated, our most lonely. A lot of these people who are not necessarily known to social care, and this sort of opens up a different way of working and a different way of how we need to target people within our communities who without the right support will come to our doors, and if we can help them to sort of look after themselves in the community. I think we also need to think differently about how we work with our carers. Again, we've done a huge amount of work during COVID, but we know that carers have been under immense pressures where services are being closed and lack of provision has been available, and we need to look at how we work collectively with our carers. And I also wanted to reference homeless people, and obviously, again, the council worked very closely with district colleagues around the Everyone In campaign, but we know that homeless people often fall between the stalls of different service needs, and we need a kind of collective approach with our partners about how we work with this group at the earliest time. Okay, move on. So just to very quickly reflect on the contracts that we're asking to extend. So we had a number of contracts that we'd already done a lot of work on in terms of reviewing and looking at next steps with them, which had to be paused during COVID. And it feels like this is a real opportunity for us to do something a bit differently with these contracts and to ensure that they are informed by this new approach and the way, and these would be some of our key drivers to making some of this work come to fruition. So what we're asking is that these services are extended quite considerably till August next year, by which time we will have got some of the early steps in place around the prevention strategy, and we can align these pieces of work to that strategy to drive forward our next steps, and those cover services for older people, services for people with brain injury and learning disability, as well as deaf support services. So that brings to an end the presentation. So if anybody's got any questions that they'd like to raise, please.
Thank you very much, Claire. That was really illuminating. Any questions or comments from councillors? Councillor Muriel Wise, please. Muriel.
Thank you, Chair. Thank you, Claire, for that, Gary, for that presentation. It's really impressive. And I think it's really exciting, impressive that you've managed to move this forward during the COVID period. I've just got a question about the board that's being set up, which sounds really encouraging. I mean, there have been some good pieces of work in terms of co-production over the years, but they've been in smaller areas like the work with seldom heard carers and so on. Could you just say briefly how the board is going to be convened?
So yes, thank you. So we're still at the very early stage, and obviously we wanted to bring it here before we could establish the board. But and I should have said this, but co-production will be at the heart of the way that we will seek to address the needs of this group going forward. And what I'm envisaging is there'll be a sort of a high-level board in which we will obviously want voice of the people of Nottinghamshire kind of directly in that board, but there will be a number of sort of subgroups and pieces of work going on at which we will also be working kind of co-productively, and this will align to the wide piece of co-production work that obviously has come before this committee before, in terms of the way that we'll be working with task and finish groups and other pieces of that sort of wider the cogs and wheels of the co-production sort of strategy. So that is something that we'll be looking to do with and some of that will come down to some of the different strands that will fall underneath the strategy, as I say, like carers. I mean, there's already work going on co-productively with carers, and we are setting up a carers sort of subgroup really, which has a parallel co-production group that will work alongside that group, made up of local carers.
Thank you.
Thank you very much. Joyce, please.
Thank you, Chair. I suppose it's more of a comment than a question, Claire, and that is on page 6 of 114 about public health, and we mentioned there mental health and also drugs and alcohol. And I came across something, I only caught it this morning on the news, that charities were complaining about the lack of funding for particularly young adults around drug abuse and alcohol abuse as well. And I wonder whether, I know we're going to be talking about suicide and mental health more generally at agenda item 7, but I wonder whether specifically you know anything about the funding and whether it will have any impact on what we want to do within public health.
Some of my public health colleagues on the line, and they might be able to answer more specifically to that. I think one of the key things will be about how we work across with public health and sort of adult social care. And so some of our services, which perhaps before have been very sort of delineated or sort of ring fenced, I think what we're hoping to do is to look at how we work more flexibly across different, and that we create less sort of boundaries.
Thank you. Corporate Director, please.
Yep. So Councillor Bosniak, you may have seen that some funding for mental health was announced over the weekend for recovery from COVID. So what we're hoping to use that as a springboard for is a better conversation with our mental health partners and health partners to think about what we need to put in place in the coming months around recovery from COVID. In terms of specific spend around drug and alcohol, Kath Pritchard is on the call and she may want to talk to you a bit more detail about that. We've now had confirmation of the public health grant for next year, so we only had that very recently, but that gives us a bit of stability for the next 12 months. Kath, I wonder if you may want to comment on the drug and alcohol bit specifically.
Yes, certainly. The funding that I'm aware of is particularly for inpatient detox. That I'm aware of that there's been some additional funding announced for Councillor Bosniak, but I'm happy to pick up with the drug and alcohol lead and ask that question of them. I have to say I didn't hear that announcement this morning, so apologies about that.
Thank you. Thanks, Chair.
Thank you very much. I've got no further speakers, so we'll now move to the vote. In order to make the voting clear for each agenda item, I'll ask Joe to read out members' names alphabetically for them to confirm whether they're voting for or against the recommendations or whether they're abstaining. Joe, please.
Thank you, Chairman. And just to confirm that this will just be a roll call vote, not a recorded vote, unless requested by 2 members or more in line with the Council's normal recorded voting procedures. Councillor Bosniak.
For.
Councillor Butler.
For.
Councillor Elliott.
For.
Councillor Fielding.
For.
Councillor Harper.
For.
Councillor Martin.
For.
Councillor Purdue-Horan.
For.
Councillor Sissons.
For.
Councillor Vickers.
For.
Councillor Weiss.
For.
And Councillor Woodhead.
For.
Thank you. That's carried unanimously.
Thank you, Joe. We'll now move to item 5 on the agenda, which is Strength-Based Approach Programme. Now, I noticed the numbering is different on the front sheet to the actual agenda, so you'll find this on pages 15 to 22. The report informs committee of the work Adult Social Care and Public Health Department is undertaking to develop and implement strength-based approaches. The report details the work led by the principal social worker to implement the 3 conversations, an approach which develops strength-based practice and focuses on better outcomes for people. I'll move the following recommendations as set out on page 21 of the agenda pack, that the Adult Social Care and Public Health Committee 1 considers whether there are any actions it requires in relation to the issues contained within the report, and 2 agrees to receive an update report in the next 6 months, and this will be included in the work programme. Do I have a seconder, please?
Second that, Mr. Chairman.
Thank you. That's Councillor Purdue-Horan. Thank you very much. So, Corporate Director, would you introduce the report, please?
Thank you. So for committee remembers in October 2019, if you can remember that far back before we had COVID, you approved a culture change programme for the department, and it had 5 elements. So owning and driving performance culture change programme for staff engagement, a new co-production approach, a revised focus on performance management, and developing strength-based practice, particularly in adult social care, but with approaches that would be applicable right across our services. So Mary Reid is our principal social worker, and Mary's going to provide a specific update on how we're doing with the strengths-based approaches element within that culture change programme. So I think Mary has some slides that she'd like to present to you all, if that's okay. Thank you, Mary.
Yes, I do. Thank you. Jenny, could you present the slides, please? So, as Melanie said, following approval by committee of the cultural change work, I've begun further development of our strengths-based approach programme with a focus on practice development. Next slide, please. One of the key messages of the Care Act is the use of a holistic approach when working with someone and identifying their strengths and capabilities and what might be available from them from within the wider community to support them. And this approach aims to move us away from a deficit model of practice to a strengths model, which is totally in line with what the Care Act was trying to achieve, that we focus on what's strong in someone's life rather than what's wrong. And as principal social worker, I've undertaken research across other local authorities who have successfully embedded strengths-based practice. And those authorities have focused on 3 conversations, community asset development, family group conferencing, and use of these approaches at evidence better outcomes for people. We're focusing on our 3 conversation approach and obviously the work that Claire has talked to you about in Strategic Commissioning around community asset development. And we're looking at reviewing the use of family group conferencing, which is about families running meetings and running and being empowered to lead their care and support. We're looking at reviewing that later in the year. Next slide, please, Jenny. During staff roadshows, we've done some staff consultation. During staff roadshows, our staff told us in relation to strengths-based approaches that they are frustrated with bureaucracy and process. They want to spend more time with people. They want to be trusted by their managers, and they want to have real conversations with people that really make a difference. Next slide, please, Jen. And in developing this approach, I've also consulted with people with lived experience who are actually now members of our steering group, our Making It Happen group, and they're helping us drive and lead this work because co-production and co-design is at the heart of everything that we're doing. We know to get the real cultural change we want across the department, that has to be our principle and our philosophy, because then we get that real commitment. And it calls back to those core values of what we came into the profession to do. As you can see from Marion's experience and Marion's story, she's part of our co-production steering group, but she's also part of our strengths-based approach programme of work. And she emphasises the importance to our staff of listening, and that their work is not just about filling in forms, but developing relationships with people to help them feel listened to and reassured. Next slide, please. So our strengths-based programme is starting with the development of our 3 conversation approach. The approach is built on the assumption that if you collaborate with and allow people to co-designers of their support, then their positive outcomes go up, their use of health and social care resources go down. And it's been evidenced where it's been used to have good outcomes, where it's been used in other authorities. And at the heart of the approach are 3 distinct conversations. So conversation 1, we're listening and connecting people to their communities. Conversation 2, that we work intensely with people in a crisis. We don't hand them off. We work with them to try and get them through their crisis and to consider what options are when they're through that. And that we're not making long-term decisions in a crisis. Conversation 3, that we're building a good life if we need to arrange care and support, that we understand what a good life looks like for people and their families. And the aim of the approach is to produce a different culture, practice and behaviour with the focus on reconnecting people and not planning long-term in a crisis. And it's also working with carers and understanding what a good plan for a carer is often means a better outcome for a person, which helps us develop that whole family approach, which again is a key principle of the Care Act. Next slide, please. We've commissioned a strategic partner who's going to come and support us with this work because that will give us the independent challenge and support practice that we need and help us develop this approach. This key partner has developed this approach across over 40 different local authorities. As I said, we've developed the co-produced steering group, which including people with lived experience, but also frontline practitioners as well. We've done communication engagement sessions and developed a community of practice where people can come and share learning. We actually issued an invitation to our staff to get involved with this work because it's so important that they're involved and co-designing this with us. The next slide, please. Sorry. The three conversation approach will be developed through innovation sites across ageing and living well services. And the sites are being co-designed with teams to define the cohort of people that they're going to be working with. For example, in the Newark Living Well Newark community team, they're working. Sorry, I'm getting some noise. They're working with people from a specific postcode, and staff will be supported to have meaningful conversations with people and focus on the person's strengths and what they want to achieve. There'll also be that loop back from our innovation sites through to our strategic commissioning colleagues. So we're looking at what is available for people in their communities and what we need to build on. So initial feedback from staff at the moment is really positive. They love the approach. It brings them back to their core values of practitioners and what they actually came into this job for. They're really excited about the work that they're going to be doing. And while we're in the innovation sites, they run for 13 weeks, we're going to be collecting evidence, both qualitative and quantitative, from people and staff about the experience and what better outcomes that hopefully they'll be experiencing. And we're going to be celebrating some stories of success that will be shared across the department and through use of my practice newsletter. And the next slide, please. Sorry. In the last 4 years, Nottinghamshire Adult Social Care has seen reduced scores in the National Adult Social Care Survey around quality of life indicators. And the focus of the work with Partners for Change is on developing practice, improving people's experience of adult social care and producing better outcomes for them. And evidence from other local authorities has seen an improvement in their quality of life indicators. The development of strengths-based practice is therefore an important foundation to underpin the range of social care improvement plans that have been previously approved by committee. And we'd like to sort of make the recommendation if there are any actions that committee would like us to consider into relation to this report, but also that you agree to receive regular updates from us about the work that was being undertaken. So that's the presentation if you've got any questions.
Thank you very much, Mary. And this is really an exciting project, a real big culture change. And I really hope I'm kept in the loop when I've gone about this, because it is really good and really interesting. And such as linking in with other projects, I've actually done the owning and driving performance myself. Yeah. And that was well worth the time. That was really useful. You have a good look at yourself. So hope it continues. Any speakers or comments, please? No, thank you. So we'll move to the vote.
Sorry,
Joe.
Sorry.
Is it Muriel?
Yes. Yes. Sorry. Just quickly. Yes, Mary. It sounds a really impressive strategy, and the idea of having the innovation sites seems to be a better way forward than we've tried before to kind of roll this out based on substantial evidence and excitement. So what will the next stage be, just very briefly, between the innovation site work and, because I think the challenge has always been having consistency of approach across the teams, isn't it? So
it is, absolutely. Yes. So we're starting with 3 teams as innovators, and then we're continuing to do some co-design sessions with other people who came forward and responded to the invitation to get involved with this work, because we want to keep that drive and that momentum going. So we're continuing to do co-design sessions, and then we'll phase it councillor wise. So there'll be the first phase of innovation, then rolling on to a second phase, and moving through to it becoming across the department. So we're working individually with each team as we go.
Yeah. Oh, great. So you have a plan.
Yes.
Thank you very much.
Thank
so
you.
We'll now move to the vote. So Joe Toomey, please.
Thank you. Councillor Bosniak.
For.
Councillor Butler.
For.
Councillor Elliott.
For.
Councillor Fielding.
For.
Councillor Harper.
For.
Councillor Martin.
For.
Thank you. Councillor Purdue-Horan.
For.
Councillor Sissons.
For.
Councillor Vickers. Councillor Vice.
For.
And Councillor Woodhead.
For.
Thank you. That's carried unanimously.
Thank you.
Thank you, Joe. We'll now move to item 6 on the agenda, which is the Adult Social Care Performance and Financial Position Update for Q3 2020 to 21. The new updated pages are 23 to 36 in your pack. So the report seeks to update committee on 3 main areas, namely the current financial position of adult social care, the performance reporting framework, and a summary of performance for adult social care and health for Q3. It should be noted that while the attached Appendix A shows a significant amount of red in the performance status, the department believes this to be for the most part the impact of the pandemic and resources being diverted to respond to this. Plans are in place to put performance back on track in these areas. The recommendation as set out on page 33 of the agenda pack is that the committee considers whether any further actions it requires in relation to the finance and performance information for the period 1st of October to 31st of December 2020. So I'll formally move the recommendations. Do I have a seconder, please? Councillor Boyd Elliott, thank you very much. So Corporate Director Melanie Brooks, please.
Thank you, Chair. So just to note, members, that this is for Q3, but we are actually in March, so we're just sort of progressing towards the end of the year. And I think what a year that has been really for the department through the pandemic. And if you remember where we started, I think just picking the first part, the financial report, we started with a very uncertain financial future to the start of the year, projecting huge overspends with the extra support we were making to the social care market and to some of the impact we were seeing on people. So it's quite really disbelief that we should end the year with such a strong financial position, which in main I think is down to a couple of drivers. I think the first one is that we found it very difficult to predict what support people need. So we've seen that support change dramatically. So we've seen the cost of care for working age adults go up dramatically, and we've seen the demand for services from older adults reduce, not least unfortunately to the fact that we've had a larger than normal proportion of deaths of people that we would support. So that has made through the year predicting how much we're spending on care quite difficult. We've also been fortunate to have received grants. Some of that's been direct from government to support us with our COVID response. Some of that's been indirect, so the health funding that I'll be talking about later on the agenda for discharge, and some of that we've passported direct to the market, such as the infection control grant, but that's helped offset some of our costs in supporting the market. So we've had a very changeable picture in terms of our finances, but we are predicting that we're going to close the year with an underspend, and Q3, as you'll see, is on page 1. In terms of our performance, we have addressed each of the areas in the yellow pages within the context of the report. But like Councillor Harper introduced, COVID's had a dramatic impact on our performance, and we are reporting red across a number of indicators, which I've got quite strong confidence is a direct result of the pandemic. So if we were to take reviews, for example,
we have been adhering to the Adult Social Care Winter Plan, which has been prioritising safe and well checks, again, which is addressed later on in the agenda, making sure that we've got contact with people, they know how to stay safe, they've got access to information. It's been a priority over undertaking statutory reviews. So our performance is still going to be reasonable on reviews, but it's just going to be read on target. In areas such as long-term care and support to people, as we know, housing pathways are particularly strained. We've had periods where we haven't been able to make placements or change somebody's placements or step down care. And we've also had moments where we've had to provide crisis support because of the impact of COVID. So if carers, example, are poorly. So those sorts of areas I think have been dramatically changed because of COVID. And then sort of lastly, employment has been a very sticky area for us, and we've had quite poor performance over a number of years, but that work has completely ceased. So we're not able to do that kind of community engagement work at the moment, supporting people to do travel training or get work experience. That whole kind of being is unfortunately paused until we can recover from the pandemic later in the year. So those are the areas that we will prioritise once we move into the recovery phase. But I think in terms of our Q4 and the whole year performance, I'm not expecting those areas to improve dramatically for the next performance report you'll receive for Q4, or indeed into the first 6 months of the next financial year. So happy to answer any questions, but hopefully it gives you an overview of where we are in adult social care.
Thank you, Melanie. And can I congratulate you and your staff for keeping us afloat in such turbulent times? Would you pass that on to them, please? Because it's really good what we've managed to achieve in really dire circumstances. Councillor Bosniak, Joyce, please.
And I completely agree with what you said, Tony. It's quite remarkable, and I can understand where we're performing and it's red, given the circumstances that we've been in. There's only one area that I don't quite understand and I'm just a little bit concerned about, and that is under assessment and reviews, and it's 1, 2, 3, 4 down. The percentage reviews where the package cost was reduced following review, long-term care. And the reason why it concerns me is that it's a high risk, it's red, and it's moving away from target. And that's the only area that I'd like some explanation about, please, Melanie.
Thank you, Joyce. Corporate Director, please.
Of course. Is it okay if I ask Ainsley to comment in some detail, because we've just undertaken a really detailed review of our support to people of working age through the pandemic, and response to carers under pressure and so on. So Ainsley can just give a flavour really of some of that work.
Okay. Yep. Ainsley, please.
Okay. So in terms of the red areas, we have done quite a significant piece of work within Living Well to look at all of our placements, particularly those in long-term care. One of the things that we've had to do this year, we had a number of people who were coded as short-term care who, because they're maybe in a placement over 12 weeks, we've had to recode them to long-term care. So that has added a number of people who aren't new people. They haven't been newly placed in long-term care, but because of that change in coding, that has had a detrimental impact on our performance, which we knew would happen. I think the other thing that COVID has thrown up, it's been incredibly difficult to actually place people during COVID. We haven't had access to the range of services that we normally would. A lot of providers have been very reluctant to admit people, into supported living, etc. We have moved some people, but maybe into settings that wouldn't be our first choice, as it were. This is something that, we've unpicked this to quite a considerable degree. We did probably a 3-month piece of work and looked at every single case. And I think the conclusion was that there were a number of cases where, had we had access to the right service at the right time, then possibly we could have avoided long-term residential care. But equally, there was, a proportionate number for whom the placement that was made was appropriate and in line with meeting their needs. I mean, there's no getting away from it that, people's needs are increasing. The complexity of need that we've got coming through, particularly in learning disability, is quite significant. And at the moment, the market isn't always in the right place to respond to that complexity of need. So sometimes we have to go for residential care because, the options aren't there. However, we do work with the commissioning team on that. I know that they're working really hard to, sort of get the right services in place for us. We've got quite a good housing strategy, but again, because of COVID, we haven't been able to push that in the way that we would have liked to have pushed it. Although that's, it's not to say that nothing new has come online. Some stuff has, but not at the rate that we would have liked. So it's I absolutely accept your sort of interest in this one, Councillor Bosniak, and it's certainly an area that we're keeping under review. The team managers are keeping it under review, as are the group managers, and we do look at this every month, right down to the detail of who has moved where and why. So we just need to keep working on it.
Thank you, Ainsley. Councillor Bosniak, okay, yeah. Thank you very much.
Thank you.
Thank you. Thank you, Ainsley, for that comprehensive reply. That was really good. Thank you. So no more speakers, so we'll move to the vote. So Jo, please.
Thank you. Councillor Bosniak.
4.
Councillor Butler.
4.
Councillor Elliott.
4.
Councillor Fielding.
4.
Councillor Harper.
4.
Councillor Martin.
4.
Councillor Purdue-Horan.
4.
Councillor Sissons.
4.
Councillor Vickers. Councillor Vice.
4.
And Councillor Woodhead.
4.
Thank you. That too is carried unanimously.
Thank you, Jo. We'll now move to item 7 on the agenda, which is the NHS England Wave 4 Suicide Prevention Funding, and the new page numbers for that are 37 to 52 in your agenda pack. The purpose of this report is to request a number of approvals from Adult Social Care and Public Health Committee to support the delivery of a new suicide prevention programme. On behalf of Nottingham and Nottinghamshire Integrated Care System, the ICS, Nottinghamshire County Council Public Health Team were successful in an application for new NHS England suicide prevention funding. Funding will total £627,483 over a 3-year period and will be utilised to develop and enhance the delivery of the Nottingham and Nottinghamshire suicide prevention strategy, to reduce the rate of suicide and self-harm through improving population mental health and well-being, and by responding to known risks for suicide in the population. The recommendations as set out on page 42 of the agenda pack are that the Adult Social Care and Public Health Committee 1. Approves the procurement of services to deliver elements of the Wave 4 Suicide Prevention Programme, 2. Approve award of contracts following the above procurement exercise, 3. To award grant funding if needed to develop or enhance community level initiatives to support suicide prevention, 4. Grants approval for the recruitment of a full-time public health and commissioning manager suicide prevention programme, post B&D subject to any job evaluation outcome, to support development and initiation of the local Wave 4 suicide prevention programme and undertake Nottinghamshire County Council suicide prevention activities. 5. Grants approval to undertake communication and public awareness campaigns, including World Suicide Prevention Way and World Mental Health Day from 21 to 24. And finally, 6. Advise whether elected members would like to engage with suicide awareness training. So I'll formally move the recommendations. Do I have a seconder, please? Councillor Purdue-Horan, thank you very much. Kath Pritchard, could you introduce the report, please?
Thank you, Councillor Harper. So thank you for that introduction. I'm going to hand over to my colleague Lucy Jones, who's going to take elected members through the report. Thank you.
Thanks, Kath. Yes, so as you've set out, Councillor Harper, the purpose of the paper is to seek a range of approvals relating to new money from NHS England, and that's for our Way Forward Suicide Prevention programme. Nottinghamshire County Council Public Health team led the application for funding on behalf of the ICS, and were successful in obtaining funding for just over £209,000 per annum over a 3-year period, and that's commencing from April this year. Funding initially will be allocated by NHS England to the CCG and then transferred to Nottinghamshire County Council, and we'll work with our legal services on the mechanics of the transfer going forward. As described in the paper, I just want to talk you through some of the 4 key themes that are aligned with the priorities within our existing suicide prevention strategy. All of the activities within each of these 4 themes are evidence-based public health interventions that are known to support a reduction in suicide rates. So the first theme is focused on developing competency, compassion, knowledge and skills of people across and beyond the local system. And that's to support them in identifying and supporting people who are at risk of suicide and self-harm. And we'll be focusing on both our statutory services, our commissioned services, and also the community and voluntary sector to roll that training out. This will support early identification of people at risk and helping to get the right support to people at the right time. As part of this element of the programme, we'll also be looking to develop community training with a view to having suicide prevention community champions. And as set out in the recommendations, there is also opportunity for elected members to undertake suicide prevention training if that's of interest. The second theme is around communications, and we're really keen to enhance communications and public awareness at a local level and develop a very strong identity for our suicide prevention work in Nottinghamshire and Nottingham. This will raise the profile of suicide prevention across the partnership, and that in turn will help us sustain system change in the longer term when the funding's ended. We'll have both universal and targeted approaches to our communications campaigns, and the targeted approach will be particularly important to reach out to those groups who we know are more at risk of suicide. We'll also make sure our communications campaigns work to reduce stigma and encourage help-seeking behaviour among the general population, linking those who need support to the right help at the right time. The third theme encompasses provision of targeted suicide prevention support for higher risk groups. And within that, we've included a focus on self-harm, so that will involve undertaking a mapping exercise of self-harm provision across the system. And then there's some funding ring fence to kind of support and develop that system, particularly with a focus on prevention of self-harm. We've also set aside funding for targeted suicide prevention support for known antecedents to suicide. And we've also ring fenced some money for a small grants fund to support local community groups enhance what they're doing around suicide prevention and mental wellbeing. And then finally, the fourth theme is to further develop our real-time surveillance system, where we monitor reports of potential suicide deaths to inform our suicide prevention work. The real-time surveillance system monitors Nottinghamshire Police and British Transport Police data on deaths that are suspected to be a result of suicide, and this information is shared pre-coroner's inquest. We use this data to identify current suicide trends and rates, and we use that to inform local suicide prevention responses so we can act in a timely way. We're looking to procure a database which will enhance this existing system. For example, it will help us better able to identify clusters of suicide deaths or emerging trends, and it will also support the development of a lessons learned process so that we can learn and develop as a system. An important element of the programme that will run across these themes is ongoing co-production with people with lived experience and multi-agency collaboration. In terms of governance, the existing Nottinghamshire Suicide Prevention Strategy Group will be the lead group with oversight for the programme, reporting into the Mental Health and Social Care Board of the ICS and City and County Health and Wellbeing Boards. As set out within the approvals, we're looking to recruit a fixed-term 3-year post that will support the delivery of the programme and also Nottinghamshire County Council suicide prevention activities. We anticipate a procurement exercise being likely for the provision of training, development of branding, targeted suicide prevention support for higher risk groups, and a database to support the real-time surveillance system. And we'll also establish a small grants process for community and not-for-profit groups to bid for funding or enhance community level initiatives to support suicide prevention. And so just to recap, as set out in the paper, our recommendations are for committee to consider approval of procurement of services and subsequent award of contracts, approval of grant funding, approve recruitment of a 3-year fixed term post, approve communications and public awareness campaigns, and advise whether elected members would like to engage with suicide awareness training. Thank you.
Thank you very much, Lucy and Catherine. I've got 2 speakers. The first one is Councillor Wise. Muriel, please.
Yes, thank you, Chair. Thank you, Lucy, for such a comprehensive report. Just 2 points. I mean, clearly, younger men are a high-risk group, and I know, is it Prince Harry who's kind of reached out in some of his sort of media work, but they seem a difficult group to reach out through normal publicity, because I suppose their high riskness is around their sense of individuality and keeping up a positive front, not necessarily being able to share what their particular challenges are. I just wondered if there's any thinking about a strategy to reach out to that group. And the other one is just raised the whole question of members briefing. The beginning of a new 4 years period. It's a really good opportunity to draw up a programme of briefings for members. I think as someone I've been involved in member and staff training in the past, I think the take-up is often quite patchy. And I think it'd be good if there could be a discussion about this particular item and what part it plays in members' training and briefings over the next 4 years, but particularly for new councillors coming in. So yeah, so I don't know where that discussion about the whole programme of members' training takes place, but perhaps something to talk about with in HR and with Anthony May. Yeah. Thank you.
Thank you, Muriel. Kath or Lucy, would you like to make any comment on that, please? Lucy, you're muted.
Sorry. Yes, I can reply around the younger men. It's certainly an area that we're interested in progressing with our Way For programme. I've mentioned co-production, so we'll be looking to have people with lived experience involved in shaping this work and how it looks, and that will be particularly important when we talk about reaching out to men with targeted communications campaigns, hearing from men who've been in that experience as to the kind of language that we need to use, where we need to reach out to people. And we've got some good contacts with other areas who've been through previous waves of the suicide prevention funding, and we'll be learning from them quite a lot of areas of targeted men with their communications campaigns. And I think it's about taking messages out to where people are already accessing. So I know a lot of areas have done work with sports clubs, with pubs. One area has done a campaign where they trained local barbers to be able to have conversations around mental wellbeing and suicide prevention. So that's all work that we'll be looking at going forward. And certainly any targeted support that we provide, we'll be looking to make sure that that is applicable to men and is available in the places where they will be most likely to access.
Thank you very much. Catherine, do you want to come in on this one?
Yes, Thank you very much. I was just going to respond to Councillor Wise in relation to member briefings from an induction point of view. And we have been asked from a public health point of view to input into that process. So I was seeing this as being part of that process around public health, but a really good idea, and potentially we may need to enhance that side of the offer. So thank you for that suggestion.
Thank you.
Thank you. I've got 3 speakers, Councillors Bosniak, Sissons and Butler. So Councillor Bosniak, Joyce, please.
Just a few things, Chair. One, I'm absolutely delighted to see that elected members have been included in this training because I've long felt that elected members have access to individuals who are quite happy to come along to our surgeries and tell us all sorts of personal things. And I think that for elected members to be able to recognise those signs and symptoms of mental ill health at the earliest opportunity would be fantastic. So I'm really pleased about that. In fact, I'm quite sad I'm going now. And then the other thing is following on from that, where we're talking about the competency, compassion, knowledge and skills part at under 12, the Wave 4 suicide prevention programmes. So we talk there about elected members, but we also talk about the voluntary and community sector. Now, I have one little bit of concern there, because it's not just enough to train people to recognise these signs, it's also about supporting people who recognise these signs and all the emotion that they go through as well. So it's almost like when you're counselling somebody, after so many sessions, you have to go and have your own counselling to get rid of all of that angst. So I'd like to see some safeguarding within that, so we're actually protecting the people that we now want to work with. Unless there's strict guidelines about, it's all about taking the information and passing people on. I'd like to know more about how that will actually work. And then the other thing was you mentioned about, and also I think some of that training should go into workplaces as well, where particularly managers and supervisors should also be able to recognise any stress that their employees are under and taking appropriate action. And then lastly, it was about young people, because I was approached a few months ago now in Mansfield by a senior police officer, because he was really concerned about this spate, this cluster of young men committing suicide. And it was in the space of about a month, and there was 4 in total. And he just wanted to know, he just seemed to be at a loss to know why this was occurring, what he could do, what he and his force could do to address this. And I think he wanted also to know who to talk to say, I think there's a problem here. So presumably when we're talking about this this board that is being established, the police will be heavily involved in that as well. Right, so I'm pleased to hear that. So all told, excellent paper, just that one area of concern about support for community volunteers.
Thank you, Joyce. Some good comments and points in that. Kath, please. You're on mute.
Sorry about that. Thank you for those comments and your support. So so going through those particular things in turn, the safeguarding element, you're quite right. And for a number of years through Public Health Reserves, we have offered training via an organisation called Harmless to the community and voluntary sector. You may well be aware that over the course of the last year, there has also been the opening up of a 24-hour, 7-day-a-week helpline through the NHS for mental health crisis, in a similar vein to the 111 service that people are probably more familiar in relation to physical health. So I think that's a useful tool to utilise. The police are heavily involved in our real-time surveillance already, Councillor Bosniak, and we have key people that we link into in relation to the police. And there is a service that is bereavement support services, both for people who have lost family members or friends due to suicide, but also potentially for the professionals who may have to deal with it. So there are there is that sort of bereavement support service as well for those who have experienced and supported that.
Okay, thank you.
Thank you.
Chair, can I just say?
Yep.
Is there some kind of analysis of, particularly where there's pockets of suicide and where some of them are known to each other as well within, within Mansfield, for instance? Is there any examination of why that could have occurred? So, any ongoing analysis where there's patterns of behaviour?
Kath?
So I think Lucy, sorry, Councillor Harper, if I ask Lucy to answer that in relation to our real-time surveillance system, if that's okay.
Yeah, that's fine. Thank you, Lucy.
Yes, so as I mentioned earlier on when I was just talking through the paper, we've got a real-time surveillance system. So we get data from Notts Police within 2 weeks of a death and from British Transport Police within 1 week of a death. We use that to look for trends and patterns and anything unusual that's apparent within the data. And also recently we've signed off a local suicide prevention cluster response guidance.
Yes.
So we've thankfully not had to use it as yet, but we've got a very robust plan in place should we identify a potential suicide cluster that we can implement really quickly a partnership-wide response. And then, as you say, Councillor Bosniak, within that, once we've kind of dealt with the immediate risks around the response, there's an opportunity for us to do some evaluation and some learning from that as well. And I think the procurement of a real-time surveillance database to support our work will make identification of clusters much easier. It'll also support us with rolling out a lessons learned programme so we can understand and learn from suicide deaths that have occurred, and that will help sort of shape our response going forward.
Excellent, thank you.
Thank you. I've got Councillor Sissons. Andy, please.
Yeah, thank you, Chairman. I'm just trying to take my hand down. Talking about the suicide prevention training, I'm the Vice Chairman of the Governance and Ethics Committee, and we've just completed a working group, which I have chaired, on the new induction programme for returning and new members of the Council in May. And just to quote from that paper, part of the induction training will be on the Adult Social Care and Public Health Committee. And Melanie Brooks and Jonathan Gribbin will give an induction on behalf of Adult Social Care and Public Health. And the session will cover councillors' adult safeguarding role. But the reason I'm speaking, on Wednesday, we've actually got a meeting of the Governance and Ethics Committee, and the induction programme is on that agenda. So I will happily raise the issue of suicide prevention training to see if that can be highlighted in the induction training as you've just been speaking about.
Thank you, Andy. That would be really useful. Thank you. Councillor Butler, Richard, please.
Thank you, Mr. Chairman. Councillor Sissons has actually just said pretty much of what I was going to say about member training. We are, as we all know, we're coming up to a new council in May. There will be a whole range of training opportunities for members, old and new. And as we all know, there is some training which is compulsory and some which is you can do by choice. Now, it's a terribly tragic subject, this, but it's so very important. And I think a message that needs to be got over to the members, and I would include existing members as well as potentially newbies, that at the end of the day, they are, after May, if they're here, they will be a councillor, and as part of that councillor role, they are community leaders. And so right across the board of adult social care, but also council services as a whole, members will be needing to be informed as to what their responsibilities are to get messages out about such matters as this. And without wishing to sound sort of disrespectful, I think that at that point there will be a lot of new members who will be keen to find out more about the authority, what it does in general. And the whole remit of the Adult Social Care and Health Committee is very high on the agenda of people's minds for all sorts of reasons. So I think hopefully you will get a good sort of response from members for training of awareness, because I think people know, whether they know officially or not, but the terrible impact of someone firstly feeling the need to commit suicide, but also the and again, it's possibly not the right expression, but the after effects, the impact on their friends, their families, their colleagues, if they're working. You know, I realise that one of the reasons why some people find themselves in such despair is because they may not be working, so they may not have colleagues. But one way or another, someone who finds it necessary to take their own life, whatever age, whether we're talking about older people or, as you pointed out, increasingly numbers of younger people, other people will be so terribly affected. And if there's a way of getting that message out, I think that is a crucial thing. And I'm not just talking about councillors here, but I'm talking about the general awareness. So I think it's such an important subject, and anything we as councillors can do between us to treat it with the respect and time it needs, and raising awareness, we must all pull together on this. And I think I'm quite hopeful we will do one way or the other. But as council assistants has said, if we can incorporate it as part of the formal training for new members after May, I think that should be very helpful.
Thank you very much, Richard. That's some really good points and comments there. And so hopefully, Catherine and Lucy, you can see that you're pushing against an open door. So exciting time. So thank you very much. I've got no more speakers on this subject, so we'll now move to the vote. So Jo, please.
Thank you. Councillor Bosniak.
For.
Councillor Butler.
For.
Councillor Elliott.
For.
Councillor Fielding.
For.
Councillor Harper.
For.
Councillor Martin.
For.
Councillor Purdue-Horan.
For.
Councillor Sissons.
For.
Councillor Vickers. Councillor Vickers.
For.
Thank you. Councillor Vice.
For.
And Councillor Woodhead.
For.
Thank you. That's carried unanimously.
Thank you, Jo. We'll now move to item 8 on the agenda, which is the local allocation to deliver the domestic abuse duty, which is on pages 53 to 60 in your packs. So from the 1st of April 2021, subject to royal assent of the Domestic Abuse Bill, it's expected that Nottinghamshire County Council will receive statutory duties for commissioning domestic abuse support services for adults and children within safe accommodation. The Ministry of Housing, Communities and Local Government have allocated Nottinghamshire £1,540,000.91 to deliver the domestic abuse duty in 2021-22. They have also allocated a further £223,315 to the districts and boroughs to enable them to support the delivery of the duty. The first year of funding is confirmed, and future funding will be allocated following the comprehensive spending review. There will be a new local domestic abuse partnership established to engage all stakeholders on the delivery of the duty. A new strategy and commissioning plan will be developed in 21-22 to fund local services to deliver the domestic abuse duty, and existing contracts will continue for a further 12 months to ensure there is no gap in provision. I'll now move the recommendations as set out on page 56 of the agenda pack, which are: 1, acknowledges the legal requirements of the Domestic Abuse Bill and the funding allocation for the County Council for the Ministry for Housing, Communities and Local Government for the provision of support for domestic abuse safe accommodation. 2, requests that the commissioning plan is brought back to the committee for consideration by July 2021 for the future procurement of services based on the outcome of work being undertaken on local needs assessment and strategy development. 3, authorises the circulation of internal and external communications on the domestic abuse bill and duty. So I've moved those recommendations. Do I have a seconder, please? That's Councillor Boyd Elliott, thank you. So I'll hand over to Rebecca Atchison, please, to introduce the report.
Thank you, Chair. And I'd like to introduce the report today by giving you a little bit more background on the domestic abuse duty. So the domestic abuse duty is a new requirement for the authority. It requires the authority to work with districts and borough councils and the PCC and other partners to improve the access and support within safe accommodation for domestic abuse survivors and their children. The funding of the domestic abuse support within safe accommodation has previously been a complex picture, and it's been funded via multiple funding pots and distributed via multiple organisations. The domestic abuse duty should make things more simple. We are currently at the point where we are completing a local needs assessment to identify the gaps in provision, and we will use this to develop the local strategy and also to commission our commissioning plan. We will prepare the local infrastructure and develop pathways and new services. And we will do this using the governance arrangement of a new local partnership board, which we are developing and setting up to start from April 2021. And this partnership board will be running alongside our domestic and sexual abuse executive for 6 months, and then we will review those arrangements moving forwards. I'll now open up to questions and any comments.
Thank you very much, Rebecca. Any comments from anybody? Yeah, I've got Councillor Wise. Muriel, please.
Yeah, thanks, Rebecca. I mean, it sounds a sensible way forward. I think we were part of the consultation, weren't we, with the government about this. So yes, it's the upper tier lead on this seems sensible, and hopefully there'll be a good partnership work with the districts. I'm just wondering about. I'm sure there is something in place, but what about the situation of women who need to be placed outside the county? Is there cross-border arrangements in place?
Thank you, Rebecca, please.
Thank you, Councillor Wise.
Sorry, just particularly with the view in bearing in mind how short of actual accommodation everyone is. Yeah.
So one of the opportunities with the domestic abuse duty is to reduce the postcode lottery that there is across the country with domestic abuse accommodation availability. So the intention is that there will be more accommodation and more opportunities available across the whole of the country, which will allow for the right options to be available for survivors of domestic abuse who require accommodation. So that's about whether they require safe accommodation within our own county or whether they require accommodation outside of the county.
Oh, good. Thank you.
Thank you very much. I've got no more speakers, so we'll move to the vote. Joe Toomey, please.
Thank you. Councillor Bosniak.
4.
Councillor Butler.
4.
Councillor Elliott.
4.
Councillor Fielding. 4. Councillor Harper.
4.
Councillor Martin.
4.
Councillor Purdue-Horan.
4.
Councillor Sissons.
4.
Councillor Vickers. 4. Councillor Vice.
4.
And Councillor Woodhead.
4.
Thank you. That's carried unanimously.
Thank you. We'll now move to item 9 on the agenda, which is Ageing Well Care Homes contracts. And you'll find that on pages 61 to 64 in your agenda pack. The report seeks approval to tender and award a multi-provider framework agreement for a period of up to 10 years for Ageing Well Care Home services. The existing open contract the council holds with each care home is significantly out of date and requires updating in order to be legally compliant with the authority's financial regulation and the public contract regulations. The report outlines the current position of the market and outlines plans for creating a more agile and fit for purpose care home services offer. I'll move the following recommendation as set out on page 64 of the agenda pack. that the committee gives approval to tender and award a multi-provider framework agreement for a period of up to 10 years for ageing well care home services. Do I have a seconder, please?
Second that, Mr. Chairman.
Thank you. That's Councillor Purdue-Horan. Claire Gilbert, could you please introduce the report?
I'll introduce the report, Claire.
Yeah.
So, sorry, Chair, Gary Jones, interim commissioning lead.
Thank you, because your video's not on, so I wondered who it was. Okay, Gary.
My apologies, it should be on. Some technical issues.
Yeah, no problem.
So, as you say, the report seeks approval to tender and award a multi-provider framework agreement for a period of up to 10 years for ageing well care home services. The existing contract the council holds with each care provider requires updating in order to be legally compliant. The tender was due to be issued in April 2020, but due to the pandemic and the impact that this was having on care homes, this was postponed. The council holds contracts with 165 ageing well independent care homes in Nottingham, 70 of which are nursing care. The homes range from privately owned small homes, often in older buildings, to large purpose-built blocks, often owned by large national organisations. They are located across all areas of Nottinghamshire. The delivery of the framework will require significant commissioning, procurement and legal input, as well as considerable consultation with the care home sector. Indeed, it is envisaged that the development of the specification and outcomes can be co-produced. The contract will also, over the lifetime, provide the opportunity to flex its outcomes as the strategic care home landscape changes in response to the demographic changes in population. Claire, is there anything you want to add?
No, I think that covers it off unless there's any other particular questions.
Have I managed to get on the camera, Chair?
No, but it's okay. It doesn't matter. Councillor Muriel Wise, please.
Yeah, yes, thank you, Chair. I'm sorry to be dense, but I don't quite understand what is being retendering if we're not, because it's not looking at fees, is it? So what are we looking at? Are we looking at something that's part of our market statement, or what will change as a result of the tender?
So currently we don't actually have, we're out of sort of contract, or the contracts are out of date, the framework under which we contract with our current sort of care homes. So this is to put in place the legal requirements that we actually need around structures under which we contract with our homes. That sets out the terms and conditions and mutual expectations. As you say, it doesn't include the fees, because that changes year by year. We sort of keep that sort of separate from the contract, but obviously it talks to how we will look and review the fee payments. So it was a piece of work that we've done. As I say, it goes back quite a long way, and we also aligned with sort of city colleagues in terms of trying to have a more consistent approach across the boundaries. But it clarifies some of the expectations. It allows us to contractually manage our services in line with our expectations. It sets out clear performance sort of measures, and it clarifies some additional points that we needed around particular aspects, such as where we have one-to-one care with an individual. So it's sort of it's put the key rationale is to put the legal framework around it, but it strengthens our quality management of the market.
And just to add, that legal mandate is often changed as the conditions regulations produced by CQC change.
Thank you, Muriel.
So does it influence the categories that homes are in, to sort of the 1 to 5 kind of thing, or our expectations of what is good practice in terms of dementia and so on? Is it all that area of practice, or?
It is. I think you're quite correct. It looks at the quality of the delivery in the care home sector and how we can improve the delivery of that care in that sector. And it'll start to look at how we manage different cohorts of the population as they get more elderly and enter into the care home sector. So some of the practice around dementia will be part of that contract.
All right. Oh, thank you. That's a bit clearer. Thank you. Thank you.
Thank you very much. I've got no more speakers, so we'll move to the vote. So, Joe, please.
Thank you. Councillor Bosniak,
For.
Councillor Butler,
For.
Councillor Elliott,
For.
Councillor Fielding,
For.
Councillor Harper,
For.
Councillor Martin.
For.
Thank you. Councillor Purdue-Horan,
For.
Councillor Sissons,
For.
Councillor Vickers, Councillor Weiss,
For.
and Councillor Woodhead.
For.
Thank you. That's carried unanimously.
Thank you, Joe. We'll now move on to item 10 on the agenda, which is tender for the Rapid Response Home-Based Care Services, and you'll find that on pages 65 to 72. So the Rapid Response Home-Based Care Service is one of the suite of services that the Council commissions to provide a range of home-based care services to adults in Nottinghamshire. The current contract for this service is due to expire, so a procurement exercise is required to secure a replacement service to commence from September 2021. The service is a county-wide short-term service which provides extra home-based care capacity at times of greater pressure. It adopts a reablement approach and supports and encourages people to regain or retain independent living skills and confidence. The report seeks approval to tender for the service and to award the contract to the successful bidder for a maximum term of 7 years, the initial contract term of 2 years with an option to extend for up to 5 additional years. As this service will be purchased through the Council's Home-Based Care Services Dynamic Purchasing System, the contract term aligns with those of the other services that are already purchased through the DPS. So I'll move the following recommendations as set out on page 69 of the agenda pack: that the Adult Social Care and Public Health Committee, 1, approves the commencement of the tender for the Rapid Response Home-Based Care Service through an open procedure for a single provider, and 2, approves the award of the contract to the successful bidder for a maximum term of 7 years, with the initial contract being for 2 with an option. Do I have a seconder, please?
Yeah.
That's Councillor Boyd Elliott. Thank you. Corporate Director Melanie Brooks, please.
So committee, I don't have anything extra to add on to Councillor Harper's introduction, but Claire, Gilbert or myself can answer any questions that you might have.
Thank you. I've got no speakers, so we'll move to the vote. So Joe Toomey, please.
We can hardly hear you, Joe.
Let's try that. Councillor Bosniak.
For.
Thank you. Councillor Butler.
For.
Councillor Elliott.
For.
Councillor Fielding.
For.
Councillor Harper.
For.
Councillor Martin.
For.
Councillor Purdue-Horan.
For.
Councillor Sissons.
For.
Councillor Vickers.
For.
Councillor Weiss.
For.
And Councillor Woodhead.
For.
Thank you. That's carried unanimously.
Thank you, Joe. We'll now move to item 11 on the agenda, which is wellbeing calls, and that's pages 73 to 76 in your agenda pack. So the purpose of this report is to seek approval for the establishment of a 3.5 temporary post to deliver wellbeing calls as part of the Council's Contain Outbreak Management Plan. These posts will provide additional capacity in the department's existing maximising independence service to be able to proactively contact people who are particularly likely to be affected by the COVID pandemic over the coming year. The aim is to link people into existing advice or services provided, including the community hub, as well as other preventative services provided by partners in the county. It will also offer information, advice and support to help people plan for later life, e.g. consideration of housing options, advanced care planning. So I'll move the following recommendation as set out on page 75 of the pack. That committee approves the establishment of 3.5 temporary full-time equivalent community care officer, grade 5 post to deliver wellbeing calls based in the Maximising Independence Service for a period of 12 months up to 31st of March 2022. Do I have a seconder, please?
Second that, Mr. Chairman.
Thank you. That's Councillor Purdue-Horan. Corporate Director Melanie Brooks, could you introduce the report, please?
Thank you, Chair. So just to note, I mentioned the wellbeing calls earlier. So this was originally part of the Adult Social Care Winter Plan, and it's one of the actions that we believe we want to continue going forward. And it also meets eligibility for funding through the Contain Outbreak Management Fund. And Ainsley or myself would be very happy to answer any questions on behalf of Sue Betty if you have any.
I've got no speakers, so no, you've got away with that one, Melanie. So we'll, Councillor Wise at the last minute. Councillor Wise, Muriel, please.
Yeah, just interested to know where the staff will be based. Will it be at the customer centre, or how will people know that they're available?
Ainsley, is that some information you have on behalf of Sue?
Not specifically, but the staff that we're talking about will be based with the Maximising Independence Service. Now, the Maximising Independence Service spans the whole county, and they are based in different geographical locations. I don't think we probably got into a level of detail yet as to determine exactly where the 3.5 additional staff would be based, but I would anticipate that they would be spread throughout the county to support those geographical spreads.
Okay.
So they're not in the customer service centre, but there is a very clear link between the customer service centre and referrals coming into the Maximising Independence Service. But this is very much about us being proactive, not waiting for people to necessarily contact the council, but actually for us to go and sort of target particular cohorts of people that may be in need or would benefit from this type of wellbeing call.
Thank you, Ainsley. So that's the information as up to date as we've got for Muriel. Thank you. I've got no more speakers, so we'll move to the vote. Joe Toomey, please.
Thank you. Councillor Bosniak.
For.
Councillor Butler.
For.
Councillor Elliott.
For.
Councillor Fielding.
For.
Councillor Harper.
For.
Councillor Martin. Councillor Martin.
For.
Thank you. Councillor Purdue-Horan.
For.
Councillor Sissons.
For.
Councillor Vickers.
For.
Councillor Vice.
For.
And Councillor Woodhead.
For.
Thank you. That's also carried unanimously.
Thank you, Joe. We'll now move to item 12 on the agenda, which is hospital discharge arrangements, and they're on pages 77 to 82. So this report updates committee on the impact of the National Discharge to Assess, D2A, Implementation Fund, ceasing on 31st of March 2021 if no alternative NHS funding is available. A new national NHS fund was established to enable implementation of policy put in place in March 2020 at the beginning of the COVID-19 pandemic. This could be used for any services required to facilitate hospital discharge from hospital or avoid a hospital admission, which was over and above that already funded by Health and Social Care. The National Fund has been used by the Council for a range of interventions. At the time of writing this report, the Secretary of State had just announced additional funding for the NHS to support safe discharge after April the 1st, 2021. But the criteria in joint planning arrangements were not specified. An update on progress with discussions with partners about the funding arrangements will be made verbally during the presentation of the report. The report also seeks approval to establish 7 temporary posts for 12 months at the Mid-Notts Integrated Discharge Hub in order to ensure timely social care discharges for people, whilst the joint improvement project to streamline systems and processes is undertaken with all partners. I'll move the following recommendations as set out on page 80 of the agenda pack. 1, that the committee approves the establishment of the following posts for a maximum of up to 12 months. 5 full-time equivalent social workers, Band B. 2 full-time community care officers, Grade 5. Do I have a seconder, please? Thank you, Councillor Boyd-Elliott. Corporate Director Melanie, could you introduce the report, please?
Thank you. So this report has been quite difficult, particularly for Sue Batty to write, and what seems on a few sides of paper, I think, doesn't do justice to the intensity of the work and the negotiations that we've been undertaking with partners in recent weeks. So if you recall, as Councillor Harper mentioned, at the start of the pandemic, we had new guidance that came out for the NHS to operate discharge arrangements, and this took us above the current requirements of the Care Act. So as you know, we currently are required under the Care Act to discharge somebody within 48 hours, and there's some processes that we've had in place for some time to support that, including a whole set of services that we fund from the Better Care Fund. This guidance took us beyond that, and as you know, a local authority needs to be funded by central government if there are new burdens upon it. And for the previous 12 months, up until Wednesday, we've been having that funding on charging to the CCG. So that was the arrangement that was put into place. At the time of writing the paper, the exact funding arrangements going forward were unknown. So we had confirmation in the speech that was made to Parliament last week, and you may have seen the funding announcement that discharge to assess will be funded for a further 6 months. But as of today, I'm unclear as to that mechanism. So the NHS has not yet received its planning guidance, which would set out whether the CCG is going to fund it and what that looks like. So we have a working assumption that it will be funded via the CCG, but we're not yet clear whether it will be funded by the BCF or the CCG. So what this report tries to do is just highlight that. We're also asking for some additional resources to be into the social work teams, that clearly we would only incur that expenditure if the funding is secured. I think the other thing to note is that through the discharge cell, we have done some really detailed, complicated modelling about what discharge looks like, because obviously through the pandemic that's varied greatly. So there's a number of things that we funded, or the Department of Health, sorry, in the last 6 months that won't continue. So things like designated spaces for discharge for people with COVID, those sorts of arrangements haven't been used fully and aren't required. So what we really want to be doing with the NHS is starting to look at what does the next 6 months look like, and then what does discharge to assess look like going forward. Hence some of the requests to do some improvement work, particularly around Sherwood Forest hospitals, which is where we've seen a huge increase in demand, which is different to the other 2 hospitals in the system. So I do apologise for quite a sort of a complicated paper that isn't quite clear about the funding arrangements for next year. But I think just to confirm that we'll only be going above the requirements of the Care Act if funding for that is secured. So that's really what we're trying to ask for in the paper.
Thank you, Melanie. And I know when it came to pre-agenda, it was really complicated. We tried to unpick it and uncomplicate it, but there's such a lot of detail in it, which there should be. So, yeah, thank you. Councillor Wise, Muriel, please.
Yes, thank you, Chair. And yes, I mean, although we had the briefing with Melanie, there wasn't a great deal of time to look at this in more detail, and I think it's important that we do this morning. I mean, Sue is obviously we know that she's a highly skilled negotiator with health, and is I'm sure a lot of a massive amount of work is going on behind this paper. The whole area of hospital discharge through the COVID period has been very challenging. All the concerns about people being discharged to homes without proper checks and so on. And I know a lot of that has been dealt with, and we're mainly here concerned about the funding. I am concerned that clearly it's been well thought through by Melanie, and we can call upon the reserves to back up the work that needs to be done. But I'm very concerned that there isn't an ASH committee until June, I understand. And from my point of view, I would want to be reassured before the end of April that something much more firmed up is in place, because I think this that there is a danger this becomes an unfunded burden. And if there is a third round of outbreak in the early autumn, then it could have all sorts of implications for hospital discharges. And I just wonder if there is an argument for a meeting between Councillor Harper, yourself, Melanie, and Joyce and myself, with whoever's leading on this, from the clinical commissioning group, to just have a clearer discussion about the processes when the CCG is aware of it, because presumably they will become more aware of what's happening before the end of April, hopefully. It just worries me, the whole uncertainty of it.
Thank you, Muriel. And unlike most committees, we did delay this one as long as we could. We're actually in Purda, but we delayed it as long as we could to try and bridge that gap. But as you say, something that's alive and working, it does need keeping an eye on. So, Melanie, please.
So the government has announced, it was very late after lobbying as referenced in the paper by ADES and LJ, but it has announced that the funding arrangements will continue for 6 months. So what we do know is there is funding for 6 months. So I don't think a further meeting would give us any more certainty than that. I think there's two tasks for the department. The first is to negotiate with the CCG the best way of spending that 6 months of funding, because what we do know is that we don't need what we had in the previous 6 months. I mean, through the pandemic, this has been a constantly changing picture. We also, through the ICS executive group, have escalated that we need to be looking at a commissioning plan now for October. We can't wait. So I think I'm fairly comfortable we're making this as certain as we can, but clearly the Department of Health didn't make the announcement until late, and the CCG planning guidance was also delayed because of the pandemic. So as soon as that's out, which I believe should have happened last week, we should have a bit more clarity about the mechanism. But what is clear is the funding is there. It's just whether that comes through CCG to us or whether that comes from the Better Care Fund direct from the Department of Health. So we should know that.
Thank you, Melanie. I think Muriel's point is that there is a catch-all should you wish to use it, should something dramatically move on. I know it to be a wonder of the world, but if it does, I think, I mean, Muriel come in herself, but I think she's offering that facility should you need it. Muriel, please.
Yes, I'd just like to hear what those processes are that the CCG is coming. I'd like to hear what they are. So the first, obviously, the longer term planning, that will probably be going on after the elections anyway, for the next stage. But it's the next 6 months that concern me.
Yeah.
And how where the money will be, just what the processes will be from the CCG in relation to ourselves.
Thank
just
you.
To be reassured that they are clear.
Yeah, no, I'm sure Melanie will keep us informed like she always does. So if anything should happen this side of the election, I'm quite confident that she'll let us know and we'll be involved in that. So thank you for your comments, Muriel. I've got Councillor Martin David, please.
Yes, thank you, Chair. Yeah, obviously I welcome this and I think it's a great idea. I mean, long gone are the days where people had to wait from Friday till Monday for somebody to come and release them from hospital. You know, and I do think Councillor Wise is very right to pick up on the prudential side of it. You know, the funding is very important. That it doesn't become another burden on the county council, because, you know, it's an ever expanding net of funding. So it'll be very appropriate for the CCG to pick up on this work that we're doing, because it's important for them, because it's a spend to save, as we know, it's a spend to save process, and it's quite complex. And I'm much more reassured for my residents now when they're leaving hospital than I ever was in the past. So I do fully support the process, but funding is equally key. Thank you, Chair.
Thank you. Melanie?
Yep, no, just to give committee assurance that the part of the rationale for bringing the paper was to be absolutely clear that without funding for the new guidance, we'd be working to the old arrangements, which is the Care Act, which is my statutory duty. So just to make that absolutely clear. Yeah.
Thank you. Councillor Bosniak, Joyce, please.
I don't want to prolong the agony, Chair, but I just want to be really clear, because the government gave a commitment to 6 months worth of payment. We're taking on posts here for a maximum of 12 months. How can we fill those posts given that they're not very long? I mean, who would apply for a job that might only last for 6 months? And are you then, Melanie, talking about if that money dries up after 6 months, it's then that you're going to be using the one-off funding of 317,000?
So the funding for the 12 months for the improvement project, we have some evidence that because we haven't completed that simplifying processes work you've heard before, we've talked about the transformation programme, that some of the things we're requiring staff to do are taking up time, so that we're not at our most efficient, particularly at Sherwood Forest hospitals. So that funding is specifically to deal with that inefficiency. 12 months is to give us the time, because we've had very good plans, haven't we, through committee to do things through the pandemic period that we just haven't delivered because of the response. So our ambition would be to complete the work sooner, but the 12 months gives us that flexibility, so we're not having to come back to committee to extend a post. But yeah, I do apologise for being quite a complicated paper, because there's the two issues. There's the improvement work at Sherwood Forest Hospital, and then there's a bit which is the core discharge to assess funding, and the two are linked.
Yeah, I see. Okay, thank you.
Thank you. I've got no more speakers down, so we'll move to the vote. Jo, please.
Thank you. Councillor Bosniak.
4.
Councillor Butler.
4.
Councillor Elliott.
4.
Councillor Fielding.
4.
Thank you. Councillor Harper.
4.
Councillor Martin.
4.
Councillor Purdue-Horan.
4.
Councillor Sissons.
4.
Councillor Vickers.
4.
Councillor Vice.
4.
And Councillor Woodhead.
4.
Thank you. That's carried unanimously.
Thank you, Jo. We'll now move to item 13 on the agenda, which is proposed increases in fees for independent sector adult social care providers, direct payments and other charges, and you'll find it on pages 83 to 94. So this report seeks approval about the proposed distribution of 6.126 million to independent sector care and support providers across the different adult social care services following full counts on 29th of March 2021, where the full budget was approved. Nottinghamshire County Council has always had a proactive approach to ensuring that it pays its providers a fair price for care, to ensure that we have a sustainable social care market of services across the county, both for people whose care the council funds and also for people that fund their own care. I'll move the following recommendations as set out on page 92 of the agenda pack, that the Adult Social Care and Public Health Committee 1. Approves the proposed distribution of 6.126 million of fee increases to independent social care and support provided across the different adult social care services related to the further increase in the national living wage from 5th of April 2021. 2. Approves the increase in ageing well care home fees in line with the fair price for care agreed inflation calculation. 3. Approves the fee increases for living well residential and nursing home placements. 4. Approves the fee increases proposed by the home care, housing with care, supported living, daycare, shared lives, direct payments and sleep-in provision. 5. Approves the increase in charges for other non-direct care provision. And 6, approves that all the fee increases be effective from the 5th of April 2021 to align with the payment cycle for the new financial year. Do I have a seconder, please?
Second that, Mr. Chairman.
Thank you. That's Councillor Purdue-Horan. Gemma Shelton, could you introduce the report, please?
Good afternoon, committee. Basically, the report, you've just gone through the introduction, so I've got nothing further to add, other than obviously asking the committee for approval for the fees from the 5th of April.
Thank you. I haven't got any speakers listed, so if there are no speakers, no, we'll move to the vote then, please, Jo.
Thank you. Councillor Bosniak?
For.
Councillor Butler?
For.
Councillor Elliott?
For.
Councillor Fielding?
For.
Councillor Harper?
For.
Councillor Martin?
For.
Councillor Purdue-Horan?
For.
Councillor Sissons?
For.
Councillor Vickers?
For.
Councillor Vice?
For.
And Councillor Woodhead?
For.
Thank you. That's also carried unanimously.
Thank you, Jo. We'll now move to item 14 on the agenda, extension of temporary posts in the data input team, and that's on pages 95 to 98 in your agenda pack. So the purpose of this report is to seek approval for the Adult Social Care Public Health Department to continue to fund 5 full-time equivalent temporary business support administrator posts in the data input team for a period of 12 months, and that's from the 1st of April 2021 to the 31st of March 2022. This will support the data input team to continue to deal with high demand caused by COVID-19 and will allow the Adult Social Care and Public Health Department to fully implement the benefits of the Simplifying Processes project that was approved by the Adult Social Care Public Health Committee on the 11th of January this year as part of the Adult Social Care Public Health Service Improvement Programme for 21-22 and to 23-24. I'll move the following recommendation as set out on page 97 of the agenda pack, that the committee approves the extension of the funding for 5 full-time equivalent business support administrator grade 3 posts in the data input team in the council's business support structure within the Chief Executive's Department for a period of 12 months from 1st of April 2021 to 31st of March 2022 at a cost of £131,062. Do I have a seconder, please? Councillor Boyd Elliott, thank you. Grace Natoli, could you please introduce the report?
So I'm Lillian Greenwood and the...
Yes, thank you, Chair. Thank you for that initial introduction. The paper seeks permission from committee to...
Grace, could I just stop you for a second? Could you turn your volume up or get your microphone closer, please?
Let me try without the... I'll try without the headphones.
Yeah,
Is
that's
that any
better. Thank
better?
you.
Oh,
that's
better. Sometimes the headphones cause an issue. Apologies for that. The paper seeks permission from committee to extend the additional capacity that we have put in the data input team. Now, the data input team provides support to frontline social care teams in terms of ensuring that everything is up to date on the system, particularly when it comes to buying packages of care through the Mosaic case management system. During the pandemic, the team has continued to see an increased workload, which has obviously added additional pressures on them. For example, I know Melanie made mention of the discharge to assess type model, which has placed additional demand on the team in terms of making sure that everything is updated on time. And of course, some of the changes we've had to do on the system to review the NHS COVID funded packages of care within the system. Paragraph 6 makes reference, as the chair has already outlined, makes reference to the department's service improvement programme 2021 to 24, which was approved by committee on the 11th of January 2021. Now, as part of that programme, the big element of that is around the simplifying processes, and the aim of that project is to ensure that the department's processes are easy to use, fit for purpose, and support a strength-based approach. We've still got quite a bit of work in relation to completing that work, as we've only just started it. And it would be fair to say that the use of the data input team has a heavy dependency on the delivery of that program of work. Now, one thing to mention, or a couple of things really, that if we don't put this additional capacity within the data input team, it would mean that actual costs of care are not known or recorded on the system, which would also compromise our ability to monitor budgets accurately. And the payments to providers would also be impacted because the information would not be up to date. And of course, whilst we're still in response mode, we need to make sure that the frontline staff are supported as much as possible, rather than focusing at this point on trying to input things within the system, which the data input does presently. Without the support of the data input team, I think it will compromise a number of things. Our ability, again, to support vulnerable people on the ground, and to give staff that bit of space really to focus on what's really important during this time. Once the Simplifying Processes project is delivered, we're looking to improve the processes so that we're not so much reliant on the data input team, so that we have some efficient processes in place that don't necessarily rely on the level of resources. So that's all I wanted to mention, and I'm happy to take any questions. Thank you, Chair.
Thank you, Grace. If members can bear in mind that there is an exempt item later on the agenda, at the end of the agenda on this item. I haven't got any speakers on this one, so Jo, we'll move to the vote, please.
Thank you. Councillor Bosniak.
For.
Councillor Butler.
For.
Councillor Elliott.
For.
Councillor Fielding.
For.
Councillor Harper.
For.
Councillor Martin.
For.
Councillor Purdue-Horan.
For.
Councillor Sissons.
For.
Councillor Vickers.
For.
Councillor Vice.
For.
And Councillor Woodhead.
For.
Thank you. That's carried unanimously.
Thank you.
Thank you, Jo. We'll now move to item 15 on the agenda, Market Management Position Statement, pages 99 to 106 in your agenda pack. So the report provides the committee with an update about work undertaken within the Quality and Market Management team. The council has a legal duty to ensure there is a sustainable social care market of social care support services available for people living across the county. The team undertakes annual quality audits, unannounced visits, support and development work with both community and residential care providers to ensure that people have access to safe, good quality care, whether it be in their own home or within a residential care home. The report gives information about examples of individual pieces of work that the team have developed or been involved with during the COVID-19 pandemic. The report also contains the current position in respect of social care providers that have had their contracts with the council suspended. So I'll move the following recommendations as set out on page 104 of the agenda pack: that the Adult Social Care Public Health Committee, 1, consider whether there are any actions they require in relation to the issues contained within the report. 2, advise how the committee wishes to monitor the issues contained within the report. So do I have a seconder, please?
Second that, Mr. Chairman.
Councillor Purdue-Horan, thank you. Gemma Shelton, could you introduce the report, please?
Thank you, Councillor Harper. As you know, the Quality Market Management team have a regular agenda item on committee, so I just wanted to update on some of the items in the report for your information. So our team continues to support the Take Up of the Infection Control grant, which has been distributed to our providers during the last 12 months and continues to do so for part of the new financial year. So our team will continue to support the care homes, home care and other providers in their spending of the infection control grant. In November last year, so in November 2020, a task force, so a COVID task force, was established very quickly within 72 hours. And part of that task force was representation from the whole system, so including colleagues from our clinical commissioning group and public health. The aim of the task force was to support on a daily basis the providers that were struggling due to COVID, so whether it was impact with workforce, impact on contingency planning, etc., etc. So we met daily to actually look at those providers and what support we could offer on that day or going forward and at that time. And just for information, at some points during December, January time, we were working with over 100 providers. So majority were care homes, but also there were home care providers that were impacted and our supported living providers. So that was started in November. Also, on the back of the COVID task force, there was a workforce task force established with volunteers from our adults team who work for the Nottinghamshire County Council. This task force was set up to support predominantly care homes where their workforce was impacted heavily with COVID. So, for example, we had one care home where near enough 100% of their staff were off sick for a very short period of time during for a week to 10 days. So the COVID task force worked with those providers to make sure they could access agencies, etc. But this task force, the workforce task force, was set up to support if needed. Fortunately, to this date, we've not actually had to implement this task force, but it has been there available as of when needed. So the providers have done really well in terms of managing their workforce during some really tough times. I may have mentioned previously, the Quality Market Management team established a 7-day working process, which is still in place, and we aim to maintain that to after Easter, where we will review this to see actually if this is needed going forward, and obviously if we need it in the future, we can also pull that back into place. As you can see in the report, a home care early deterioration project was established jointly with the CCG, and we did this during I think it was early in the pandemic, so during wave 1, working with a home care provider in the Newark area. So that's currently going really well, and I'm hoping to bring back to committee later on in the year the outcomes and the progress and the positive outcomes that's had for that provider and for those people in the Newark area. So that'll be exciting to feed that back to yourselves. We're also working with our home care providers as part of a home care collaborative working group. So working more closely with providers and home care providers working together as a group. So to obviously try and share good practice and obviously working together in the future, of maybe sharing work in the future if needed, obviously picking up some lessons learned during the pandemic. What's been really helpful and a part of our lessons learned during the pandemic is that we've set up an internal daily meeting that's led by our commissioning colleagues, so Claire's team, in terms of trying to support quicker discharges from hospital. So meeting daily to look at what home care packages are needed and trying to establish a provider very quickly. And that has been helpful, and obviously we've seen some positive outcomes with this, and hopefully this is something we're going to look at keeping on an ongoing basis. The report does say that we've continued with our quality monitoring, and that's something we're really focusing on now going forward, as well as our auditing in terms of our recovery programme, and because we've seen an increase in quality concerns over recent weeks and months, so we're trying to be proactive and working with our providers on to make the improvements needed. And one thing I do want to add in terms of market recovery, the task force, which I've just mentioned, obviously was a COVID-related task force. We are looking at that as well in the future in terms of keeping that partnership approach with our CCG colleagues, etc., and looking at keeping that on a less regular basis, but actually having regular meetings to look at the market and quality, whether it's quality, financial, etc. So that is something we're going to be hopefully incorporating into our daily working going forward. Well, thank you. Any questions?
Thank you, Gemma, and can I thank you for all of your hard work in the pandemic, because I know how hard you've worked and how much your workload has increased with what's happened in the last 12 months. So thank you for all of your hard work. I've got 3 speakers. The first one is Councillor Wise. Muriel, please.
Thank you. Oh yes, and absolutely echo, Chair, what you've said to Jem and the team. You can't imagine all that you've had to cope with. Yeah, very well done. Just a question about the early deterioration in home care project. It's not the happiest of titles, is it? Really? No. Could you just say briefly how it's been working? Because it's interesting that a provider that we have had concerns about has chosen to do this project in one area where things were going pretty well, rather than the area where things were more concerning. So what's the area of deterioration that they're looking at? Is it in the service users, or is it in the service, or
yeah,
what?
sorry. Yeah, it's part of the Restore 2 package. That's an NHS-led package of understanding early deterioration in service users. So it's something we've worked trying to. Our care homes are using, not all care homes, but again, it's a project that we're trying to implement in all service areas. So it was a project that should have started pre-COVID, but obviously was delayed, and then we decided to start it. So the provider in the report actually put the idea forward, so it's part of their initial coming to us and saying we could offer this. So it's about their staff understanding early deterioration of service users, who will then contact their GPs to actually say so it's about blood pressure, so early signs where actually it would hopefully help that they won't go into hospital. So it's very early days, and I think obviously we're working with the local GPs, etc. So it's hopefully going to be something that we do try and establish throughout the county. It was just obviously that provider at the time got in contact with us, and obviously it's something we've pursued over since early last year.
Oh, thank you for explaining. Thank you.
Thank you.
Thank you. I've got Councillor Sissons. Andy, please.
Yeah, it's not a question, Chairman. I've just realised that I should have declared a private interest in this item because my wife works in a care home in Mansfield. It's not covered during this report or the exempt item, but just for openness, I should have declared that interest.
Yeah, thank you, Andy. Joe, please.
Thank you. Councillor Sissons, we've noted that interest. If anything does become, if you can ensure that if anything specifically relating to that does arise, at that point, if you can absence yourself from the meeting, and make sure that any comments are general and addressed specifically to the topics within the report.
Yeah, I don't think it actually affects anything, but just as a matter of openness, I thought I should mention it. Thank you.
Yeah, thank you, Andy. As I always say, if you do find something in the meeting, it's always best just to mention it, just so we're all covered. So thank you for mentioning that. Councillor Bosniak, Joyce, please.
Very briefly, it follows on from what Muriel's just said, really, and that is about the earlier deterioration issue and the fact that Foss Healthcare, who I know cover both Newark and Mansfield, have chosen only to do this work in Newark. Is there a plan for them to move to Mansfield and do that? I just wonder why the same provider hasn't decided to provide the same service over both areas rather than just the one.
Yeah, no, fair comment, Councillor Bosniak. The funding was limited, so obviously, for whatever reason, I wasn't involved in the initial setting up of the project, but it was just decided to go with the Newark because I think they had an established smaller team of staff that could work this project. But it is hoping that if it's successful, and I think it's been successful within our care homes, and it shouldn't, and why it shouldn't be successful in home care, we can't see a problem, but we would like to see it spread across the whole county so it isn't just the Newark area.
Right, thanks, Gemma.
No problem.
Thank you. That's the last of the speakers, so we'll go to the vote. Joe, please.
Thank you. Councillor Bosniak?
For.
Councillor Butler?
For.
Councillor Elliott?
For.
Councillor Fielding?
For.
Councillor Harper?
For.
Councillor Martin?
For.
Councillor Purdue-Horan?
For.
Councillor Sissons?
For.
Councillor Vickers?
For.
Councillor Vice?
For.
And Councillor Woodhead?
For.
Thank you. That's carried unanimously.
Thank you, Joe. We'll now move to item 16, which is the work programme, and that's on pages 107 to 110. The recommendation of the report, as set out on page 108 of the agenda pack, is that committee considers whether any amendments are required to the work programme. So I firmly move the recommendation. Do I have a seconder, please? Councillor Elliott, thank you. Joe, are there any changes to the work programme arising from our discussions today, please?
No changes to the work programme arising from the discussions today. There are a number of actions that have been picked up where committees asked for more information. We have the initial item where further information was asked around alcohol and drug abuse and funding for that. And the other element was around, just bear with me as I scroll through and look for my highlights. The suicide prevention item going as part of the training proposals to the Governance and Ethics Committee on Wednesday's meeting, and again just making sure members are kept up to date regarding the funding that was still pending confirmation for the there are far too many items for the hospital discharge arrangements item.
Thank you very much, Joe. Thank you for keeping us in line with that one. So there are no speakers, so we'll move to the vote, please, Joe.
Thank you. Councillor Bosniak.
For.
Councillor Butler.
For.
Councillor Elliott.
For.
Councillor Fielding.
For.
Councillor Harper.
For.
Councillor Martin.
For.
Councillor Purdue-Horan.
For.
Councillor Sissons.
For.
Councillor Vickers.
For.
Councillor Vice.
For.
And Councillor Woodhead.
For.
Thank you. That's carried.
Thank you, Joe. We'll now move to item 17 on the agenda, which is exclusion of the public. So we now move to that part of the agenda that proposes we meet in closed session to consider the exempt information in relation to agenda item 18. So I therefore invite the committee to resolve that the public be excluded for the remainder of the meeting on the grounds that the discussions are likely to involve the disclosure of exempt information as described in Schedule 12A of the Local Government Act 1972. And the public interest in maintaining the exemption outweighs the public interest in disclosing the information. Do I have a seconder, please?
Second that, Mr. Chairman.
Thank you. That's Councillor Purdue-Horan. So for the avoidance of doubt, I'll ask the clerk to capture the votes on this one also. So Joe, please.
Thank you. Councillor Bosniak.
For.
Councillor Butler.
For.
Councillor Elliott.
For.
Councillor Fielding.
For.
Councillor Harper.
For.
Councillor Martin.
For.
Councillor Purdue-Horan.
For.
Councillor Sissons.
For.
Councillor Vickers.
For.
Councillor Vice.
For.
And Councillor Woodhead.
For.
Thank you. That's carried.
Thank you, Joe. So this therefore is the point at which we'll end the live stream. So may I take this opportunity to thank any viewers for their interest in the meeting and to wish you all well. So please end the broadcast.
You'll be as pleased as I am that as we move through March, the days are getting longer and we're starting to see a bit of spring coming through and some warmer days. And with that, it's fantastic, isn't it, to be able to get outside a little bit more and to enjoy the open air. But it's really important that as we do that, that we also keep in mind all of the measures that are in place in this very first step of the roadmap. It allows for us to meet up with one other person for recreational activities outdoors. But it's really important that even as we do that, we keep in mind all of the social distancing measures which are so important. The reason they're important is that there is no shortcut we can take to the end of the roadmap. There is still quite a long way to travel, and during that time we need to make sure that the rates in Nottinghamshire come down further. You can play your part in that by sticking to the rules at each step of the roadmap.